I am Dr. Tony Scott Terry. Weight loss medication, and is it right for you? Weight loss is something that mostly everybody has had some type of journey with. And I say journey because it is a journey. It's not something that's, a one and done. It's a lifestyle change. So when we see and talk to people, I've had lots of patients who they're, getting medications offline. They're using their friends or their siblings or parents, their medication. These medications are just that. They are medications, and you have to treat them as such. So one of the things I tell people, taking the medication without doing anything else is not going to end at the point of what you're actually looking for. The medications are meant to actually help you in your journey for weight loss. There are injections that you can do, there are pills that you can take. There's a list, there's probably about 10 to 12 different types of medications that you can use for weight loss. So the big popular ones are the injections, so the Wegovy, the Zepbound, which generic names are semaglutide or tirzepatide that people have talked about. There's other ones that are coming out soon that probably a little stronger than the Zepbound and the Wegovy. So there's a variety of medications. However, these medications have side effects, and if you don't take them properly, you will not feel great. One of the biggest things I tell people is that exercising is great. We have to do it. We have to build our muscle mass, but your diet is going to be 70 to 80% of all of these changes. So a lot, and you've probably heard this. You can't outwork a diet. So you can work out 5 days a week. If your diet is horrible, you're not going to get what you're actually looking for. So I encourage people, definitely know what you are putting in your body. Carbs, there are good carbs, there are bad carbs, but carbs is the source that your body uses first for fuel. If you have an excess amount of carbs that you have taken in, then those carbs will actually turn to fat and it starts to store it. As we get older, we are losing muscle mass. So you've got to increase your protein intake. I encourage people to do a minimum of 100 grams. Some of the trainers will probably tell you to do a lot more than that. But I encourage the protein intake because it helps maintain your muscle mass. Now, as far as the injections are concerned, a lot of the injections work in the gut, in the stomach. So it slows the movement of the food processing down. And it sends signals to your brain that you are full. So when a lot of people are taking these medications, they're like, I don't want to eat. I don't want to eat. But if you don't eat, it makes your body think that you are actually starving it. And so then it starts to slow the metabolism down. Now, if you're doing intermittent fasting, that's okay. But there's a way to do intermittent fasting. You have to do the same times every day. So if it's a 14-hour fast, it has to be the same time for the fast. And that is so your body gets used to eating at that time and it knows that you are going to supply it with nutrients during a certain period of time. But with the injections, if you are doing a lot of carbs, you will be nauseous. I tell people that up front because I've had a lot of people who have said, well, I took it, but I had really bad side effects. If you're continuing to eat an excessive amount of carbs, then, and I'll tell people to try to stay below 150. Everybody's different with what they suggest to people. That's just my suggestion to my patients is to try to stay below 150 per day. That's very easy to get to. Very easy to get to. You have a bag of chips. Some of those bags are probably anywhere from 30 to 50 grams of carbs just for that one small bag, not a regular bag, a small bag. So you have to know what you are eating, what you are drinking, and what the nutrients. How many carbs is in that serving? What is a serving? Because most of us don't do one serving. I had a client who he likes Pringles. And I always tell people, I'm not going to tell you that you can't have it. Know how many carbs, how much protein, and what a serving is. So if you can't stop with just one, don't buy it.
Especially
Because don't buy it. Don't bring it into your house. Because if you are on a lifestyle, which is what I like to call it, a lifestyle journey, then if you know that that's your weakness, don't do it. If you can't control it. If you can control it, great. But if you can't, don't do it because you're going to eat it. The other thing I tell people with those medications is constipation is one of the side effects. So you have to increase your fiber intake. You should be doing 64 ounces of water no matter what. That is 8 glasses of water, 8 ounces. That's 64. That's what we should be doing normally. But if you're doing those medicines, you have to make sure you're doing your water. You have to make sure you are doing your fiber. If you are taking in fiber and not increasing your water intake, you are going to be bloated and you are going to be uncomfortable. So I'm trying to prevent these pitfalls so that your journey is a little easier for you and you actually get to where you are, what your goal is. Take your vitamin D. If you are not out in the sun, you're not getting vitamin D. You need to take vitamin D on a regular basis. I suggest to people to take vitamin D3 with K2. Um, B12 injections you can do. It'll give you a little bit more boost of energy if you're deficient in that. There are pills now for Wegovy. There's another pill called Bendeo. They're still the same medications. However, it's a pill form. So with the pills, you have to take them every day. Here's my suggestion to people. You know you better than we do. If you are someone who has difficulty with control, then the injections may be a better way to start. Because once the injection is in your system, you cannot change your mind. It lasts for 7 to 10 days. The pills are a little different. If you decide you don't want to take the pill that day, because I'm going out and I want to eat whatever I want to eat, then okay, you have a choice to not do that, but it kind of takes you off of your goal. So there's Phenermine. Phenermine has been around for a long time. It's an appetite suppressant. There's Contrave, there's Costimia. These are all pills. They will help control your appetite. What I suggest to people is that, once again, you know what your weaknesses are, you know what your strengths are. I've heard every reason. I have to buy it because the grandkids are coming over. My response is, well, why do you want your grandkids to be in the same position that you're in now? So kids can only eat what you buy. So if you're buying it, then you are sending them down a different road. I'm not saying people can't have treats, but when we were growing up, McDonald's was a treat. It was maybe once a month. Lucky if it was once a week. We do it all the time now. Fast food is it's not going to change. It's here to stay. We have to manage it. Mm-hmm. So don't give the reason that the grandkids want it because the grandkids don't have to have it if you don't buy it. So once again, managing your stress, that's a part of weight loss journey. Getting your sleep, that is a part of weight loss journey. If you have sleep apnea, if you're someone that snores or you stop breathing or your partner tells you stop breathing in the middle of the night, that's sleep apnea. And that increases your risk for heart disease. So they do cover for some of them. Zepbound is one that will cover, well, each insurance is different. Let me just say that. But if you have a diagnosis where you've actually had to have a sleep study and you have sleep apnea, then a lot of the medications may be covered by your insurance because they have discovered that weight loss actually improves a lot of things. High blood pressure, diabetes, cholesterol, but it also improves sleep apnea. So once again, The goal of it's not just about weight loss, it is about managing stress, managing your sleep. If you are a drinker, you've got to watch wine, dark liquor, higher in sugar. I'm not saying I never said you couldn't have it. I'm saying you have to watch it. And being an avid label reader and knowing what's in the food or what you drink is important so that you know what your intake is. So that's my spiel on weight loss slash lifestyle management. We're all getting older, but we want to get older in a healthier way and continue that process of feeling better, looking better, and enjoying our lives. We're all talking about it. It's everywhere. Everyone, the the movie stars, the next door neighbor, everyone is talking about it. But there is a way to do it. I've had people say, their doctor just said, well, just lose weight. And they didn't know how to lose weight. But it is a lifestyle change. And we have to make sure we're not just talking about the medications. We are talking about a lifestyle change.